welcome everyone. You've joined us at this joint webinar between Fusion Occupational Health and our partners at Bodyline. Just to let you know, we are recording this session for some colleagues who are unable to attend. So, introductions then. I'm Clare Hurley. I'm the Managing Director here at Fusion Occupational Health. And joining me is Sally Turner, who's the founder of Bodyline.
Good morning.
As some of you will know, it's World Menopause Day today. So in celebration of this, we're hosting this joint webinar to recognise menopause and more specifically discuss menopause in the workplace. In addition, we're going to show you how you can support your employees in the workplace, and I'll be sharing my own experience of menopause. After this session, we're going to share the webinar with you and a menopause in the workplace starter pack. We won't have time, unfortunately, today for Q&A session, but if you do have any questions, please feel free to put them in the chat and then we'll answer you on email at the end of the webinar. And alternatively, if anybody has any questions they forget during the call or they want to contact us afterwards, please contact us at info@fusionoh.com. That's info@fusionoh.com. So thank you. I'm going to pass over to Sally now. So I'm going to be asking Sally now, I'm going to ask you, Sally, what is menopause and perimenopause? And how do we know if we're at that stage?
Okay, so menopause is a period in a woman's life, and perimenopause and menopause are obviously perimenopause is before menopause, and I think that there's a lot of myths around is menopause this long or this long. It's actually quite different for different women. Mm-hmm. So if we look at menopause, the actual definition of menopause is if you've not had a period for effectively 12 months, and that can range for different people. Perimenopause is where you're experiencing symptoms before the actual stage of menopause. Now, interestingly, we're seeing a lot of patients a lot younger with perimenopause because the NHS with their guidelines don't really treat perimenopause. And really they look to treat people from sort of like 47 onwards. We're seeing people in our service sometimes from 30. So we're seeing a lot of interesting data coming through about the earlier stages of perimenopause where people have got symptoms, menopausal symptoms, but they're in perimenopause. So, and really, menopause is really defined by a number of symptoms, and again, that's different for everybody. Yeah. Now, I think that there's some sort of like talk about, well, there's 48 symptoms of menopause, and that there are a lot of symptoms, and they're up there on the scale of the around about those 50s, but it can be different again for everybody. So it depends on how many of those symptoms you've got and the severity of those symptoms as to what the impact of menopause or perimenopause really would be.
And could you just explain to us some of those symptoms that people can be experiencing at this stage?
So the most common that obviously from our background is we obviously treat patients in menopause, so we have a lot of experience of actually seeing what those symptoms are and the impact that they have on people's careers and family lives and those types of things. So I'll talk about the most common ones, and the most common ones are really hot flushes, brain fog, your anxiety. There are other elements such as you can start to connect UTIs and those types of symptoms to it, itchy skin, joint pain, so on and so on. Now the list goes on, and if we just look fundamentally why there is such a wide range of symptoms, it's because of fluctuating hormones. And as women, we have a lot of estrogen receptors in our bodies. So that's why you will get varying symptoms depending on how those hormones are fluctuating. And some people will have more severe than others. So, you know, for example, you know, we look about estrogen receptors around, you know, some people have irritable bowel syndrome. Well, we have estrogen receptors around our bowels and things like that. Now, you wouldn't necessarily link that to menopause. But if you think about the element that if you've got your hormones doing this and you've got estrogen receptors in areas, it is going to have effectively an impact. So that's why that range is so vast. And very often what we find, the types of patients that we see, the dots haven't necessarily been connected from an NHS point of view. So it, you know, it can be very siloed that you've got a condition and that's not related to menopause or perimenopause. So really where we are is it's got to be very personalized. For some people, you know, the traditional routes do work, a holistic route works. Sometimes it doesn't. Sometimes, you know, they've got to look at HRT as an option in order, depending on the severity of you know, those conditions. But that's what we effectively specialise in, is for those patients who've the other routes really haven't worked, and you know, then they're looking that they're in this occupational health area. And what are the options? Well, at the moment, if the NHS option hasn't worked, then it needs a more personalised approach in order to get a result. And we understand what the restrictions are around that. So the types of patients that we see are those patients that traditionally have done the holistic route, have maybe tried the NHS route and it's not worked, and we look at it personally in order to adapt that to get them on the right journey. You know, so, and it needs more focus. So that's really where we are in that space.
So how do you treat the symptoms of menopause and perimenopause then?
So we do a complete symptom checker, okay, which is you know, the start point for everybody. But the additional element that we have is that we actually would do blood profiling. So we've had our own blood profiling test developed, and that's a capillary test. So this is why we can scale up from an organisational point of view, that, you know, people can do that remotely, because this gives us a really, really good benchmark as to where that woman is. And it gives us a start point that then we can refer back to at various points in order to help them on that journey. So, for example, we can gauge where they are with their estrogen levels, and some women might have enough estrogen. It's you know, the other hormones that we have to look at. And the other thing that we know from treating a lot of patients in this area is that we've got the fundamental hormones, so the estrogen, the progesterone, and the testosterone. But we also look at B12. We also look at magnesium, which is key, vitamin D, and zinc. Now, those we find, interestingly, 50% of women who we test are low in at least two of those. So we know the data is, you know, and if you think that you're low in your vitamin D and B12, for example, we know that we need to also address that as well, because that will be part of those symptoms, like fatigue, for example. They're not sleeping properly. So if you imagine, it's not an easy job to get all of the hormones balanced and all the vitamins balanced, but that's what we do. And so once we've got that to a point that is right for the patient, we then see the reduction of the symptoms. And that's how we will then gauge it. So how do we know that somebody is having a successful journey? Every 12 weeks, we go, right, let's go through that list again. Let's find out, are you sleeping better? Yes. I am sleeping better. Okay, we've got that one. So, you know, the whole process is to get the reduction in those, and also to concentrate on the priority ones and what we think that is with our experience. And what we know is dosages and a one-size-fits-all dose with hormones it doesn't work for some people. So, you know, we have to use quite low dosages with some people. Some people have a sensitivity to progesterone, so we look at the other options around that. So just a patch for some people that has estrogen and progesterone and is just not an option.
No,
So
you're right.
So you know, that those are things that we look at, and it's quite hard to get that supported journey in the NHS. You know, you may well be lucky and have a specialist menopause GP who's interested in this area and can provide that, but it is pretty quite rare to get that. And I think that that's what we're seeing with a lot more occupational health providers now, saying actually for those people who've not had success and, you know, the severity of their menopause or perimenopause is significant, that it's affecting work, they're in the occupational health arena, that we can offer those specialist services, and more employers are looking to put this in their benefits package.
Yeah, that's right.
You know,
brings me on to my next question, Sally. I was going to ask you, how can it affect people in the workplace, and what can we do to help people in the workplace? What adjustments can we make, those types of things?
So I think that there's a lot of resources out there at the moment on education and awareness of, you know, obviously looking at putting the education through your line manager, structures. You know, there are physical things that we can do in the workplace, which are simple things like, air conditioning, fans on desks, having the right chairs, you know, having flexibility to have breaks, all of those types of things, depending on what type of job that you do. And those, you know, those are pretty fundamental health and safety things, aren't they?
Yeah.
I suppose what we see is that there's nothing after that. So, you know, if we have a look at who is in the occupational health system, are they in occupational health system with anxiety and depression, and actually that's not been diagnosed as menopause? So how many people are in there where if we gave them the education, if you looked at the age range of where they are, that's the first, that would be the first thing to do, and understand, because don't forget, a first line treatment for NHS in some of these cases is antidepressants.
Yeah.
So how many people have you got in that box that actually, because we've not educated, or that they don't know that there's that specialist help around menopause, could we pull out of that box and actually get a result for? So I think there's the education and awareness piece, which I think what we've seen of around menopause month this month, there is a lot of free resources out there. There's a lot of things that we can do around educational. We're obviously very much in the clinical arena of you know, this is how we can take people on that journey. But there's a lot of free resources around education, but we do have to recognize this, because as the data becomes more and more from providers like myself as saying, look, you know, it's a significant part of your workforce, and not a lot of, you know, that there's a lot of people out there who are not having an easy journey with it that does impact work. And, you know, when it is significant, you're getting them coming out of the workplace, leaving, significant posts to replace them. So the cost case is pretty easy and transparent. We've done that for a variety of large organisations. And what we do see is the demand is being pushed from the employees as well.
Yeah.
So the demand is not necessarily from the employers, but the demand is from the employees, people who are building this into their benefits packages. Women want that type of service and are prepared to have a look at that as a fundamental criteria for employment.
Yeah, I think you're right. And, that's another question. How can we make our workplaces more inclusive when it comes to menopause and perimenopause? Because there's a huge amount of women in that age category. And how do we make our workplace more inclusive?
So I think it's all around education, and it's around the education. I think if we speak to patients and hear their stories, if they had been educated to where we are today with menopause, they would have treated it a lot earlier, because they would have connected the dots a lot earlier. So that's the story that we hear time and time again. Had I known about that, and I didn't really put it down to menopause or perimenopause. So as we educate, and that's men and women, because it's both, because invariably men will have partners who they see this transition. So, it's about being all inclusive with men and women, that it's not a taboo subject. And I think we've got over that hurdle now. I think we're over that now, because the education and awareness is so good that people are prepared to talk about it. What I do think there has to be a fundamental shift is that occupational health providers call it menopause. So they've got mental health, they've got musculoskeletal, all of those other areas. I think menopause has to go down there, and a referral process. So if we educate the line managers in order to deliver that in a certain way, that people feel open enough to say, actually, I do think it's menopause, and I'm not getting a result with my NHS pathway, for example. And we know that can be quite significant because of the amount of patients that we see.
Yeah, definitely.
So I do think it starts with education.
Yeah, I think it does. And, moving on from that, it's making sure that you've got board sponsorship for this, got a policy in place, those types of things. That is so important to ensure that that's cascaded down through the business.
Yeah, and I think that, making those, and as we know, there's, a policy is a policy. It's about making it living and breathing, within that. So types of things that we undertake for organisations is we'll go along with our nursing team. We'll have a menopause day where they can come. We'll take their observations, their blood pressure. We can do a blood test for them. We can start to educate from that perspective as well, where people feel open enough. It's not, now some organisations may have, we offer for is a confidential helpline where they can come and have an initial triage. So it depends on, some women might not want to do that. So I think that you've got to understand your organisation and how you might roll that out. So do you want a mixture of both, of going, you can come along, you can do that awareness, we can do webinars, we can do talks, we can do that, involve men, because I think people just then feel more open to be able to speak about it. But it is about education of going, the range of symptoms and the massive impact that this can have if we don't get solutions, and those solutions are different to everybody.
Yeah, you're completely right. So how can both Fusion and Bodyline help help our clients manage menopause and perimenopause in the workplace?
So I think it's what we look at is it's always very good to know what your benchmark is. So we'd almost do a menopause audit, which is, okay, what does your organisation look like? What's your menopausal landscape look like? If your intention, if you've got 2/3 of your workforce that are female, then obviously that's quite significant. And how would you look to roll that out? So what does your menopause policy look like? What does your education and awareness bit look like? And what does your occupational health provision look like? And also put in a costing case, towards that, to say, are you going to look at, from a cost perspective, part fund those treatments for people from a consultation point of view, which you would do on mental health, for example, or physio, for example. There are a number of things that we can do, and every organisation is individual, aren't they? So depending on what their workforce, so we would work with yourselves and as jointly to go, what does that landscape look like, and what does that solution look like? As to how to, because I think that any forward-thinking employer will be including this in their range of wellness platform. There's absolutely no doubt that, you know, we'll be going through a 5-year process where innovative of treat, you know, the options that we do, they're expanded. There are not a lot of people in occupational health doing full end-to-end treatment options, because our treatment options goes right through to delivering the actual medication to the patient, because obviously we know that there are shortages around certain estrogens, certain progesterones. So we provide a full end-to-end service which is direct to patients, so it doesn't overlay over the current NHS system. So I think we'll see more innovation with the type of treatment options. There's a lot more testing around coming on of the new tech research around vaginal testing, swab testing, in order for us to get a gauge of what's going on there. So I think that innovation in this area in female health is really advancing, and it's quite an exciting area. But what that means then is that's translated into better treatment options for occupational health providers and employers. So I think that that's how we can help, you know, depending on the size of the organisation. And, you know, we have certain pathways, you know, and if you know, our pathways extend for those complex patients, and we would work with the NHS on, you know, if that's medical intervention from the NHS of gynecology or whatever, we'll write to their GP, say, look, we need this person referred through this process. So we'll encompass all of those aspects because we're CQC registered. So we are provide those healthcare services under that private healthcare scenario, but we specialise in that. And of course, another thing with menopause is weight for women as well. So, you know, it's we look at those holistic areas of, you know, treating female health and connecting the dots and getting the right solution for that employee.
Great, thanks, Sally. So I've been, so basically, I just wanted to speak to you now about the process of getting some help for somebody with menopause. So it's really easy if you're already a client of Fusion. You just need to log a referral on our case management system, giving us the reason for referral as menopause. So what we'll do then is we will clinically triage that referral and choose the correct pathway for that individual. And this could result in a consultation with one of our nurses looking at particular workplace adjustments that need to be put in place, or if appropriate, and you as a client are in agreement, we would offer a referral onto Bodyline for that individual. We also have the ability for individuals who want to fund the Bodyline treatment themselves to self-refer. So if an individual needs to do this, all they need to do is contact us on info@fusionoh.com, and then we can directly refer them into Bodyline, into Sally and her team, who can then suggest the appropriate pathway for them. And I've been through the process, okay? So I have been suffering for around 3 or 4 years with different symptoms on that I didn't really connect. As Sally said earlier, I didn't connect them. I have very aching joints, and I'd been to my GP about my aching joints. I'd also been about my itching skin, lack of sleep, all of this type of thing. And you know, the GP was quite quick to recommend different treatments. So treatments for bursitis for my joints, they wanted to put me on some form of antidepressants to help me sleep, which I didn't want to do. So I was really, I felt a bit daunted by the experience. And when a Bodyline referral was available for me, I was a little bit skeptical. I've got to be honest. I've been dealing with my symptoms for 3 or 4 years and thought, I don't know whether this is menopause or not. But after reading some of the information that I had at hand and educating myself, I thought this could be. So I had my first consultation with Bodyline, a nurse called Bernie. She had made me feel immediately at ease. I wasn't on my own. There was lots of women going through this. And, you know, the experience was absolutely wonderful with her. So we did the symptom checker to start with. So we went through, you know, they asked me questions about different symptoms I have. And I was like, well, yeah, I do have itching skin. And I found that I found that quite embarrassing in the workplace because I'd constantly be itching my head, my body, and I felt like, you know, I'd be at face-to-face meetings or team meetings, and I'd be constantly itching. So that was something I thought was down to an eczema or something I'd been prescribed with loads of different creams, etc. But, you know, after speaking to Bernie, I realised that that could be a symptom of menopause or perimenopause. So I had my symptom checker, went through all of that, and I was absolutely gobsmacked by the amount of symptoms that I had highlighted that could be connected to menopause. Then I had my blood profiling. So the blood profiling brought things to, you know, really to reality for me, because I was going through my GP, and I have nothing against the NHS. The NHS are great. They help us all at all different times. But it doesn't seem that my GP was very educated in the menopause field, because, you know, after I'd had my blood profiling done, I found that unlike most women, my estrogen levels are very high. My progesterone levels were extremely low. So if I'd have been given some sort of HRT patch, which is where it was sort of going, I think I would have suffered much, much more, because my estrogen levels would have been so high that I wouldn't have been able to cope with that. So since doing my blood profiling, I've now received vitamins that I need to take, and I've received 2 different hormones that I need to take. So I've seen the symptoms decreasing. I've got my second follow-up check with Bernie in a couple of weeks' time. And again, we'll go through that symptom checker again. We'll check that everything's right. And then if she feels that I need more help in any areas, that's exactly what we'll do. But, you know, I just wanted to share with you guys that that experience was absolutely wonderful. I felt like I was being listened to for the first time. And to connect those dots was amazing, Sally. So please pass on my thanks to Bernie, because she's been wonderful.
I will. We've got, thank you very much for that. And, you know, it's nice to hear, you know, that experience as MD of Bodyline. I mean, we have a number of specially trained nurses just in, and it's a long training process. This is not, GPs get 2 hours on menopause. My nurses spend 6 months specialist training on this area, because it's quite complex, and it's a complex area. It's not simple, and the learning process also is on treatment of patients and what we see, because some of that data is not out there. Because if you think where that data is really coming from is the NHS, and that's not really very good at reporting. So a lot of that data from medical point of view of how to better treat this is really coming from providers like ourselves and our experiences. So, you know, that's why, you know, we're very proud of the results that we do get for patients, because it's very supported and it's very personalized. And, you know, we know that works for that certain area. Skin is a big one. And conditions such as eczema and things like that, because obviously we have a lot of estrogen receptors on our skin.
Yeah.
So you when those dots get connected, it seems quite obvious.
Yeah.
And this is why I think that, you know, it is important maybe to have these you know, webinars and things like that, and we can provide all of those to say what types of things would women be experiencing, and those types of things, and we can do all of that from a supportive point of view. It is about education and then taking people on a journey, going, actually,
Sally, I'm going to need to bring our chat to an end, I'm afraid.
Okay.
We're come to the end of the seminar, but thank you so much for joining me. It's been great to speak to you, and everybody else on the call, thank you. I hope you found that useful, and please don't forget, if you have any questions, please just contact us, info@fusionoh.com. Thank you everyone, and have a great week. Bye.
Have a great week. Bye.